Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, July 12th. I'm joined by Deputy County Executive Ken Jenkins, and we're here to give you a weekly update on some of the key issues that are happening in Westchester County. These updates originally began as COVID updates, and that's where we're going to start our presentation today. But we were doing them a year ago on a daily basis, and then we ratcheted back to 3 days a week, 2 days a week, and now to once a week on Mondays at 2 o'clock to try to cover some of the information that may be helpful to you, both about COVID and then about some other different issues that are at hand. We also have a guest today, as we do on each of these updates. The mayor of the village of Larchmont, Lorraine Walsh, is with us. And as we've had at each of these updates, one of the mayors or supervisors of one of our communities to talk a little bit about what's happening in their community and their priorities, so that you get an idea of the diversity of Westchester County and the challenges that are faced, which are not always the same from community to community, but we've got a great group of local leaders that we partner with, and we try to work together on the issues that are more broadly based and also on the ones that affect your lives more directly. So we'll hear from Mayor Walsh in a few seconds. First of all, I'll give you the COVID updated information. We have this through our tracker as of yesterday. The numbers have not yet come out on Monday, for Monday today, July 12th. So we're working off of Sunday, July 11th numbers. And we've seen an uptick in the number of active cases. In the last couple of weeks, and particularly in the last week, the number of positive tests have increased over where they were 2 weeks and 3 weeks ago. Just to give you a flavor, on the 22nd of June, we had 11 positive COVID responses out of a few thousand tests. And in the last few days, we've broken 33 on the 8th, 32 on the 10th, and 32 on the 11th. Where that leaves us today is year-to-date, or pandemic-to-date, 130,081 people have been tested positive for COVID at some point in time during this pandemic, beginning in March of 2020. 129,830 of them have gone through the 2-week period in which their system has resolved the matter. So there's 251 active cases of COVID as of yesterday here in Westchester County. Now that number is dramatically down from what we had in the middle of January, when we had 11,500 cases. And our great peak came in the very first month of the pandemic, where we had over 12,000 active cases. So to be down at 251 is a very good number, except that that number has been rising consistently. A week ago, that number was under 200 cases. So we have seen an increase in the number of positive COVID tests that are happening. We are trying to investigate now to determine if the people who are hospitalized, which is a much smaller number of individuals, are hospitalized and were unvaccinated at the time that they entered the hospital for COVID-related illness. The breadth of the disease is reflected by the number of infections and the number of active cases. The depth of the disease, the seriousness of the disease, is seen by the number of people that are hospitalized and the number of fatalities. Right now, in terms of the depth of the concern, the numbers have not been bad. We currently have 14 people hospitalized countywide. That number is slightly up over where we were a week ago at 11 cases. Now, we had gone higher, as many as 19, but we're down to 14 hospitalizations at the moment in our 11 hospitals in Westchester County. And we're very happy to report that we've gone 2 solid weeks without one death to the COVID-19 virus. We've still had 2,293 individuals perish from the disease, but not one person in the last 2 weeks. And if you go back slightly prior to that, we're almost 3 weeks with only one fatality. So the fatality numbers are down, dramatically so, and the hospitalization numbers are low, but the number of infections are up. Well, we're going to try to find out to the extent that we can. There are HIPAA laws that restrict how much information even we as a county government can know about the people that have either tested positive or have been hospitalized, or for that matter have died. What we're looking to determine is, are we looking at elements of the Delta variant that is happening, and are we looking at elements of people that are affected because they are unvaccinated? The general concern that we would have is that if the number of cases are going up and there are people affected who have been vaccinated with 1 or even 2 shots, then that is of great concern. But everything that medical science is telling us is that the Delta variant is not more severe, it's just more communicable. And the people that are exposed to the communication of this disease are those who are unvaccinated. We are approaching 80% of our population, adult 18 years and over, that have been vaccinated. We're still in the high 70% range. Nassau County hit 80% in that metric. The president had established a goal of 70% of the nation by July 4th, which is a week ago, which the nation did not reach. But in New York State, we reached it, and in Westchester County, we've exceeded it as we approach the 80%. But 20% of the population unvaccinated, if that's what we're talking about, is still a significant number of people. If you generalize and say we have 1 million people, that means, in round numbers, 800,000 have been vaccinated, but 200,000 have not. And if 200,000 are subject to the disease, it's not surprising to me that we have 30 people testing positive today and 30 people testing positive yesterday, compared to having 5 or 6 or 7 tested positive a couple of weeks ago, if the variant is the reason that there is a greater spread of the disease. We have, at the state level and locally implemented, lifting the mask mandate. It is still a mandate that can be imposed by any particular entity. You can go into a store or a particular place of business or location, and they may choose to require people to have masks, but they are not now generally required across the board unless you're on a mass transit system, so the Beeline bus system, Metro North in the city, the subway system. If you're entering a hospital or a nursing home, there are a few other facilities like that, a homeless shelter, where there's sort of a congregate, close quarters of interaction. But as long as there's some natural social distances and you've been vaccinated and cleared the 2 weeks after the vaccination to make sure that you are as fully protected as you can, then you don't need to wear masks. I had the pleasure on the night of July 4th to be at Mayor Walsh's village in Manor Park, where they have an annual Dixieland concert at 7 o'clock, and people were enjoying it, and they were unmasked. They were in an outdoor park, and they had some social distance between them, and it was a perfectly wonderful evening. And the expectation that we have is that we're opening up more and more of the society. But we are going to be realistic when we look at the numbers. And so right now the numbers do show that there's been some increase in the infection rate and the number of active cases. So again, I say that as a cautionary measure, and we will continue to track it. We'll continue to try to understand what comprises that number. And if it does in fact represent the presence of vaccinations, we can't help but make that connection because we had a very high level of active caseload, a very high level of hospitalization, and a consistent fatality rate in January. And January is when we began the vaccinations. And the county, as I've mentioned, has really done a tremendous job working with the state and through local pharmacies and various other entities to issue a number of vaccinations. Just in our major vaccination locations, which include the county center, we've issued 443,000 vaccinations. That's having had 0 vaccinations 6 months ago before we started this process. And of course, the county center has been the main event for us with over 300,000 of those 400,000 vaccinations. So we believe there's a correlation. We'll see if we can make that connection. And if that is the case, then it comes back to individuals who are unvaccinated. Whatever those vaccine hesitancy reasons are, what we're watching is the diminution of a very deadly disease, and it's being diminished because of vaccinations. So we encourage individuals to consider seriously what their objections are to having a vaccine and whether or not those are well-placed objections. Individuals may have individual circumstances that you can't deal with on a general basis. But right now, the ability of our society to open is in direct proportion to how the spread of the infection is reduced and the number of people that are sick and die are reduced. And the more that is reduced, the more we open up the society, get to fully open, get back to fully normal. We want fully normal. We want, as Mayor Walsh will tell you about in a second, the concert in Constitution Park that's coming up on Thursday night. But we're going to track those numbers and see exactly where they stand. I will tell you that the vaccination numbers at our facilities, particularly the county center, has been dropping dramatically. It appears that everybody who wants a vaccination has received it. And so now we're dealing with that portion of the society that is vaccine hesitant or vaccine resistant. Over the course of the last few weeks, we have dropped down to less than 100 appointments at the county center in a facility that vaccinated over 2,000 people a day in the peak period of demand. So the demand has dropped dramatically. Today, there's 168 vaccinations scheduled for the county center. And again, that's 168 people scheduled. You can walk in and get a walk-in vaccination if you choose. We'll see what the walk-in factor is. But 168 vaccinations today at a facility that was set aside that at times has vaccinated 2,200 people in a given day. So there's a big difference in the demand that we're seeing now. There are no plans to close the county center at this point. First dose appointments have been extended for a few days more until Wednesday, July 14th. And of course, when you get a first dose, you have to come back and get the second dose. At this stage of the game, we expect the county center to continue to be a vaccination center. We did get back Glen Island, which we had turned over to the state as a testing center, and they became the first drive-through testing center in the state. Very successful when testing was the concern. Now testing is fairly widespread. We received the park back from the state, control of it 2 weekends ago, and Glen Island has opened up for beach usage and for picnicking and its usual uses, which we're very appreciative of. It's good to have that park back in our inventory. But the county center is likely to stay as a vaccination center for a while. We are waiting to see what medical science tells us about the need for booster shots, and if booster shots determined to be necessary, and we have to use that facility for that purpose. We are vaccinating those who are under the age of 16, who were more recently made eligible for vaccinations, Pfizer vaccinations, between the ages of 12 and 16. And we await to see if medical science opens up the door for those vaccinations for those under the age of 12. Currently, no one under the age of 12 can be vaccinated. And that, of course, is a factor in those numbers that we give you, where we look at those who are 18 years of age and older rather than the full population. The full population includes a cohort of young people that are not eligible to get vaccinations. So we test how well we're doing on vaccination against that portion of the population, 18 and over, that has been eligible now for the last couple of months to receive vaccinations. Also want to mention that we have a county dashboard with certain information that we've had up and operating for a while. It has been updated. You can link to it if you go to westchestergov.com, which is our Westchester County website. The vaccination rate is now updated in real time with all of the statistics that we receive from New York State. And we remind you what we have said in the past. We do not have any data that's reported to us as a county government directly, nor to the villages, nor to the towns, nor to the cities. New York State is the repository of reporting on testing and also on vaccinations. And then as we receive the information, we then try to break it down and provide it to the local governments to the extent that it is given to us in that format, and we make it available to the public on this dashboard that we've spoken of. The state dashboard will give you countywide numbers. It will not give you things broken down below that. We are trying to do that in a continued effort to be as transparent as we can, given the information that we can. So we encourage you to go to westchestergov.com to the dashboard, which has been updated. We went a period of time where it was not updated, but it is updated now. Now I'd like to turn to the village of Larchmont. I've had the good fortune of representing that community in a number of different public positions for almost 30 years. And I've come to know the village as well as a person who doesn't live there can know it. I certainly know the restaurants. You can tell by my waistline. I know the parks, and I've been to just innumerable number of community events. It is a village with a great sense of pride and a great reason to have that pride. They have tremendous services in a very small 1 square mile area and a population that is very loyal to the community and have done a lot of voluntary activities to improve the community. I mentioned briefly Constitution Park, which underwent a major tremendous improvement over the course of the last year, and so much of what went into that park's improvement did not come from the government. It came from individuals who volunteered to assist this government improvement. And so the leader of that village is the mayor of the village. She serves without compensation. Very important to know that a number of places in Westchester County, there is no compensation for local officials. I was a Rye City councilman. That's one of the communities without compensation. So she does this because she wants to do it. She wants to provide service to a community, and we're very happy to have her with us here today. She served as a village trustee before her terms as mayor. Mayor Lorraine Walsh. Madam Mayor, thanks for being with us.
It's nice to see you.
Thanks.
Thank you very much. Thanks
Pleasure.
for having me here today. I'm going to start with a short look back. I know that we're talking about going forward, but I don't want to miss this opportunity to publicly thank County Executive George Latimer and the entire staff at the county level for all of the leadership and communication that they had with the local governments throughout this past year plus. The guidance, the information, and the assistance that they provided to the local governments on how to handle every asset of going through a pandemic was really invaluable, and without that, we certainly wouldn't have been able to do the jobs that we did. So thank you very much, both of you. I would say that I'm very happy and grateful to say that Larchmont came through the pandemic fairly well, and that's not to minimize the personal impact that anyone did feel. But as a whole, we had a couple of spikes when the rest of the community around the county did, but things never got very out of hand. And in terms of finances and the health of our downtown, we managed to weather the storm. George mentioned how the residents of Larchmont always band together and really very supportive of the things we need to do. And during the COVID shutdown, many residents got together and formed organizations which raised funds to give grants and low-cost loans to some of the businesses that were really struggling and would have had to close their doors if not for that help. We were able to open up at the reopening a year ago, getting our feet right on the ground and running in terms of outdoor dining and using the sidewalks and the public parks to support our businesses, as well as planning socially distant, safe outdoor activities for our residents to enjoy. We have lost some of our longstanding businesses, and that's always a sorry thing to have happen. But here we are in July of 2021, and we actually have a net gain of business compared to February of 2020. So I'm very happy about that outcome. Right now, Larchmont had one active case in the month of June and one active case in the month of July. And I think that is an example of the fact that the 10538 zip code has an incredibly high vaccination rate. And so more evidence that people need to get vaccinated in order to stay safe and stay healthy. Going forward, we are planning for a wonderful concert this Thursday evening. Our summer concert series is on. We also are planning for our 130th birthday celebration on Larchmont Day in September. We have the Arts Festival planned. And we also have a lot of capital projects that we postponed in order to buffer our budget when revenues were down from certain sources. And we're certainly looking forward to receiving the money from the federal government through the ARPA that we are earmarking for a lot of capital improvements to Village of Larchmont. And I think that about covers my update.
Thanks,
So thank you very much.
Appreciate it.
Thanks.
Glad you could join us. Mayor Lorraine Walsh of the Village of Larchmont, she and her colleagues, the 4 members of the Board of Trustees, really have worked very cooperatively with the county, and we appreciate that cooperation. And sometimes the cooperation, represented both levels of government trying to figure through some very thorny issues, some of which were created at other levels that we didn't have control over. But we weathered the storms that we were facing, and we managed to get through it so far. And we hope we'll continue to go forward, and do express to the rest of your village board our appreciation for their leadership and their service in the Village of Larchmont. We will continue to have other representatives here. If you haven't watched these over the course of the last few months, I believe we have had every elected leader of the community here at some point in time or another, and we intend to invite them back for an updated round and to continue that information that shares both towns, cities, villages, and the county together as a cooperative group. And Thursday night at Constitution Park begins a series of Thursday night concerts. Everyone's welcome to come. It'll be a wonderful time. So thank you, Lorraine, again, to have you with us. Ken Jenkins is going to tell us a little bit about some of the satellite vaccination centers that we have coming up. We're trying to amplify the availability of the central vaccination facilities. We have our clinic here in White Plains at 134 Court Street that administers vaccinations, as well as the county center one. But when we're trying to reach out to particular markets, particular areas of people that have not been vaccinated, we're trying our best to come up with vaccination pop-ups. And the key here is to make sure we have enough people to warrant setting up the structure and the system of this. In the beginning of the pandemic, very much in demand. Now we're, with the lower demand, we're working at it. So Ken, please give us an update on those areas as well.
Thanks, George. And certainly, as the county executive mentioned, again, from the vaccination sites, to see how the infection has continued to drop when we see those folks that are in the hospital, as the county executive was pointing out, the CDC and Anthony Fauci, Dr. Fauci, continue to say almost 100% of the people, we're going to try to get the number for sure, but 100% of the people in the hospitals and the ones that have unfortunately have passed away have not been vaccinated. So we really encourage everyone to take a look and be able to get involved in that. We have 3 vaccination satellite locations. Some folks call them pop-ups, but it's more appropriate with the satellite location today until 6:30 p.m. So 6:30 p.m. at the Peekskill City School District High School cafeteria. The Peekskill City School District High School cafeteria until 6:30 p.m. and walk-ins are available. So you're able to walk into the sites, and any of the 2 other sites that I'm going to mention, you can walk in as well. Certainly, it's preferable to have an appointment, but is not necessary. Tomorrow, in Irvington, in the village of Irvington, we're having at the Irvington Union Free School District in the middle high school library tomorrow, the 13th, from 2 to 6:30 p.m. Once again, you can make those appointments on the county website. It's a county-run operation, so you can make an appointment through the county. However, you also can do walk-ins there as well. And as the county executive pointed out, whether it's at the county center or anywhere else, the number of appointments has been dropping down dramatically from the time when it was Hunger Games trying to get an appointment. Now you can walk in and get that appointment. Then on Saturday the 17th, so the 17th from 10 a.m. to 2 p.m., back at Westchester Community College. That's in the gym at Valhalla. So Westchester Community College, the signs will direct you appropriately from 10 to 2 p.m. And it is, again, so very important that everyone gets the opportunity to be vaccinated so we can all enjoy those wonderful concerts. I'm not sure what time it is on Thursday with Larchmont, but the county executive will let us know. But please take advantage of those opportunities to get vaccinated as quickly as possible. Thank you.
Thank you very much, Ken. I'm going to talk about 2 other points before we break for of this update. The first one is our efforts that we're making now to do diversion training for the various individuals who are staffing call centers around Westchester County. Our Westchester County Police Reform Task Force evidenced, amongst many things, a significant need to have in place people who are trained in mental health crisis actions and behaviors to be able to respond to certain types of incidents that arise so that they can provide an appropriate level of response rather than just a normal police response, which usually has to deal with force in the face of some particular threat. We have established a series of 911 diversion training sessions at our Department of Emergency Services, and we had our first one kicked off this morning. Our location is in Valhalla in the Grasslands campus on Dana Road, and we call it 911 diversion training because you, the individual, pick up the phone and dial 911. The person on the other end of the line is the person that has to be trained to be able to get the information about the emergency and then know who to dispatch or how to dispatch. Some of that dispatching comes here in Westchester County facilities. Some of it happens at the local levels of government in the police stations or other locations out in the various communities of Westchester County. And we want to make sure that everybody who is potentially a receiver of an emergency call knows how to be able to ask the right questions, understand the nature of what they face in order to dispatch the right types of individuals. We have made a commitment in implementing the police reform program that was passed and submitted to Albany. We had 52 recommendations. One of them was the creation of mental health crisis teams. We've determined that to cover the county properly on a 24-hour basis, we need 8 of those crisis teams to be in effect. And it's going to take time for us to pull the right personnel together, get them properly trained. We believe by October 1st, as a target date, we will have at least 3 of those teams in effect, and we'll identify the areas that they'll operate out of. But in the meantime, we want everybody who's on the receiving end of those emergency calls, and people are usually in distress at 911, and they may not know all the details of everything that they could, and they just sort of want to tell you what's happening as quickly as they can because something is happening in real time. We want those people to be as trained as possible so they can dispatch, as I've said, the right type of circumstance. The training that we're doing now is funded through the Federal Substance and Abuse and Mental Health Services Administration. It's through a grant to a partner, People USA Incorporated, which provides that information for the Westchester Crisis Stabilization Team. The county is embarking on this as a first step in order to try to make sure that we can identify and divert callers who have serious needs as well as those in crisis who pose no danger to others. And that's an important distinction, and it's a distinction that's not always easy to make, and it's certainly not easy to make for the person that receives the 911 call. They have to be able to understand how to identify the appropriate crises services. It also works to ensure that when we need a medical response as well as a law enforcement response, that we have the proper response available to us. For dispatches, this adds a fourth option for dispatch: police, fire, medical services, usually through EMS, and now behavioral health. This is a fourth category of dispatch that becomes, in essence, our first responders. And training to identify callers in crisis or need, as I said, is part of what all of this is. This is an essential first step. The training programs have begun today. Those individuals who are active in the various communities within the programs are our target, and it's important for you to know that we're going through that kind of training. You've certainly heard incidents that have happened around the country where an individual is in a situation of mental health crisis, and the response when it comes may turn it into a tragedy. So we want to make sure we put the right services there. We want to have a police presence to deal with those things that are life-threatening to other people, where there's some law enforcement need. This is an enhancement to make sure that that response is made as appropriate as possible by having mental health properly trained individuals. Just want to highlight, final point, that our county parks have been exploding in demand as we've gone through this period of time. Now, we've had a period of very high, hot, humid weather, so that's moved a lot of people to our beaches and pools. On the other hand, we've had rain and lightning, and the minute we see lightning, things shut down. You know, we close up playland, we close up beaches. We want no one to suffer any potential damage through an electrical storm. But over the course of the last week alone, we've had over 35,000 visitors to Playland, just in a 7-day period, which included some rain days. We had a washout here and a washout there, and we're not open 7 days a week at the park. There are Mondays and Tuesdays normally where the park is closed. Now, in the prior week, Monday was the celebrated Independence Day, so the park was open on July 5th. But it's normally closed Mondays and Tuesdays, but a 35,000 person visitor response is a very good response. We've had a couple of weeks that it was open prior to that. First weekend we had about 16,000 people that attended, and then the front end of the Independence Day weekend was also well received on one individual day. The Sunday of that weekend we had 13,000 people in attendance, so that number is very, very strong. We have seen all of our parks, all of our pools, I should say, show some strong numbers over the course of the last week. 2,000 people have visited our Wilson Woods pool in Mount Vernon. We had 4,000 visitors to both the Saxon Woods pool and also to the Tibbetsbrook pool. Actually, Tibbetsbrook's close to 5,000, and 3,000 at the Sprain Ridge pool. So we're getting a good, solid base of people that utilize these services that the county has provided. And I would remind you that the Sprain Ridge pools, 2 pools there, were closed for roughly 6-7 years. They reopened briefly in 2017. One of the pools had to be closed down because it was not construction appropriate, and were reopened in 2019. We're very proud that we were able to reopen those pools, and they're closed for some of 2020 as we had to reduce the attendance last year. Now we're back to a more normal year. We haven't had a normal year there in a long time. But we're very happy that Sprain Ridge is open for the people who live in Yonkers, nearby Hastings, and Greenburgh, who are the closest people to use it. And then also our golf courses have been getting tremendous use ever since the pandemic began in 2020. We had an amazing year last year with golf rounds that were tremendous. And this year we're off to another single start. Over the last weekend, or last week, I should say, we had over 7,000 rounds of golf, public golf played at our 6 golf courses, and really tremendous response by the golfers. And we think that's yet another important recreation. And our Bicycle Sunday program continues throughout the summer. We were off on Independence Day weekend, which is the prior weekend, and we will continue to go all the way through Labor Day, take off Labor Day, and then continue on Bicycle Sunday through September and into October. And we appreciate the generosity from a number of different sources. Westchester Parks Foundation is the prime sponsor of that, and we have some other corporate and individual philanthropic supporters for Bicycle Sundays. What all of this means is, and it's really part of the COVID update, is that we're trying to make sure that we provide safe alternatives for people to recreate, because people must have that ability to get exercise, must have that ability to interact socially, to do it in a setting where they're safe, and that is a setting outdoors that can be done. We certainly showed last year, when we were closer to the heart of the pandemic, that we could manage beaches and pools with a lesser attendance and still do it without spreading the disease. The disease did not spread during the summertime when these facilities were open. We're able to expand the occupancy in both of those elements at Playland as well, and hopefully we have a very healthy opportunity for people to enjoy the recreation that Westchester County provides. And we've made a great point about the money we've invested in these different facilities, and we're glad to see that the people of Westchester County are using those facilities, which are their facilities at the end of the day. I'm going to check with Catherine Chaffee to see if we have any questions. We have 2 questions.
Yes, we have 2 questions.
From our friends in the press.
Yes, the first one is from David Proper from the Journal News. He asks if there's any indication that the Delta variant is in Westchester. Has it been confirmed?
I don't have a confirmation of the presence of the Delta variant at this point. However, this being the beginning of the week, we expect to see additional information. Usually about the middle of the week, we'll get some information from the state. We'll certainly let both David at the Journal News and any of the other members of the press know if we've seen it here. We've seen the increase in the amount of infections, and it would lead me to think that there would be some exposure, but we haven't had it confirmed yet by any of the folks in the medical science. And I do just want to highlight, federal government passed a law which protects health information of individuals. HIPAA is the acronym for it, and it protects you from unwanted knowing of your health circumstances. And that law prevents us from finding out more directly what the status of these things are. We need for the state to release information to us. At this point, no sign yet of the Delta variant in Westchester County.
Okay. And the next question is also from David, and this is the last question that we have today. Any idea if these positive COVID tests are coming from a certain part of the county?
Well, the number of tests that we have countywide have been broken down by different municipalities. You heard Mayor Walsh say that there was one active case in Larchmont. So we do have a breakdown of it. I don't have it in front of me. When we're dealing with a number of 30, we would look for a high concentration of multiple numbers. Generally, what we've observed over the years, we've watched this now for 16, 18 months, it tracks the population of an area. So you can assume that the 5 largest population areas, which are Yonkers, New Rochelle, Mount Vernon, White Plains, and the town of Greenburgh, will likely have the greater number of these cases. The secondary areas of concentration, City of Peekskill, Village of Ossining, Village of Portchester, are the next most likely ones to have it. So when we look at the spread of, say, 30 cases today or 30 cases yesterday, if we see it fall into that geographical pattern, then we believe we're looking at something that's widespread. Now, you may not see it in Pound Ridge because of the relatively low population and the relatively sparse spread out of the population of the community. But we will look for those breakdown numbers, and we'll be happy to share them publicly as we do on the dashboard and in other fashion. Very good. Well, thank you. Any other members of the press that have any questions, they can reach out to Catherine Chaffee, our Director of Communications, at 995-2932. I want to thank Catherine and her team, which includes Lisa Reyes, Joe Scamato, Carolyn Fortino, Chelsea Pagano, and John Borst for their work in helping us keep this information flowing. They're the folks who deal with that every day. They have to get some things from the health department, some things from the state, and to present it in a way that you can reach it, whether you're a member of the press or a member of the public. And so we appreciate your work, Catherine, and the folks with you. So we'll sign off for today. We intend to report again a week from today on Monday at 2 o'clock. Whether we'll be here in the county office building or at some remote location is to be determined. But if we have any other information, any other topics, we'll certainly present that for you. And if you have any questions, you can give us a call. In the meantime, stay safe, and we'll see you soon. I'm George Latimer, County Executive. Thanks for watching.